Nice thing about healthcare is we can all sort of tell stories, and I thought I was at the stage of life where healthcare was really something done by my wife to my children. But my conversion on the road to Damascus came in a hotel in Leeds when at about 6:30 in the morning I was just brushing my teeth with a glass like this. That is the last thing I remember. When I next came round, I'd clearly slipped over something and was lying on the glass. And actually the injury was not something I could shake off. So in a modern world, I got on my laptop, I looked up where the walk-in centre was. It opened at 7, so I had just 20 minutes to wait until they would answer the phone. I rang them up and they very helpfully said, actually it's the wrong sort of walk-in centre, but there's one just slightly further around the corner and you can go and get yourself patched up. So I went in there, very efficient, got in there, seen, said, do you need an x-ray? Went round to the x-ray, and that was one of the first instances that made me think that things had changed. So they took my x-ray and they came back a minute later and said, actually we've got the shot slightly wrong, we need to take another one. So they gave me another x-ray and said, actually no, we've got that fine, and off you can go and get patched up. So I went to see a nurse practitioner, was cleaned up, super glued back together and sent on my way, and happily for PA I was on client site by 9:30. So it struck me in all that how much had changed and how little we understand how much had changed. So that episode with the x-ray just 3 years ago would have taken about 4 or 5 hours for it to be read, for the mistake to be spotted, for me to be sent back round, and for the right image to be taken. In fact, what we've probably done is done suboptimal care and not taken the next one and patched me away and then said, actually, there's probably some glass in there and we'll just ignore that. The nurse practitioner, changing professions, even changing techniques and medical devices. And you know what? The only thing that failed me in the whole thing was in reception when they asked me who my GP was. And I was carrying my little European health insurance card with an NHS logo on it. I said, oh, well, actually, here's my number. It's a different number. So all I could say is actually it's the practice in Oxford, halfway up the Banbury Road on the right-hand side by the big tree. No, that's not good enough. So healthcare has changed and has come a long way. But my word, what a lot of challenges there are in healthcare. So we read the papers every day and we read about rising costs, we read about aging populations and chronic illness. But we also read some actually other surprising headlines. So only 2 months ago, there was a report published that said something like 80% of the £10 billion spent on diabetes care was completely avoidable. And the World Health Organization issued a statement again this spring saying that the world where we assume that infection can be dealt with by antibiotics may be over. Just imagine when actually a little bit of nip and tuck or even the arthroscopy on your skiing injury is potentially fatal. Actually our attitudes would change very, very quickly. So healthcare has all these challenges, and I think the question in healthcare is now no longer what can be done, but what should be done given the finite resources and the ambitions that we have. And actually how can we make that healthcare as good as it possibly can within those limits. We've seen probably 3 themes really come out very strongly over the last few years. There's a theme around healthcare reform, and I'll talk a little bit more about that. A very, very strong theme around patient-centred care. And behind that, broadly, something we would label intelligent healthcare. So let's think about healthcare reform, and I think healthcare reform is really laying the foundations around which everything else can happen. It's sort of setting the rules, whether that be the professional standards and the structures, whether that be the payment regimes, but it's trying to provide an environment within which everyone in the healthcare system can innovate, and which may allow new actors to enter coming into the future. So patient-centred care, and in some cases this is a cry rather than a reality, but it does run through, as a theme, it runs through almost everything that we do. And if we go back to the diabetes example I was given, why is it that so much care is wasted? Well, some of that is because actually some of the preventative care requires cultural change in the people who are delivering it, but some of that is actually just inefficiency within the system. So there's a really interesting map that's been produced by the Department of Health, the Atlas of Inequalities, that shows a correlation between long-term outcomes in diabetes and the percentage of people who get the 10 prescribed checks in diabetes annually. And that there is a quality deficit, partly because these are complex things that need to be coordinated across multiple providers. And patient-centred care goes in all sorts of different directions. So of course there are the concepts of stratified medicine, but there is also the concept of joining up a continuum of care. So it's not just what happens in the hospital, but what happens outside it and beyond it. And within that umbrella, that's one area that we are seeing a huge amount of innovation and convergence across different markets. So within the last 4 months, we've had conversations with utilities who are looking at the impact of smart meters networks. The mobile industry has had a buzzword of M-Health for a long time. Of course we're working with providers and of course we're working with people looking at either reform or how they organise their operations to respond to the reforms that are happening. And this is a momentous day today for those that are actually also operating over the other side of the Atlantic. Because I don't know if any of you have picked up the headlines, but Obamacare got through the Supreme Court challenge more or less unscathed. So actually, it's not just what's happening in the UK, and we have a huge body of experience in the UK about driving towards quality and outcomes and holistic care. But that knowledge is actually exportable now to more and more markets around the world, and is something that we should stop to think about. So I've talked about reform and I've talked about the patient-centred care. Well, if all of that has happened, then information is the steam that's driving this new industrial revolution. And we see information creeping into almost everything. So our work on medical devices increasingly involves connected medical devices and the crossovers that sort of involves. We see information as the key to breaking down the boundaries that are the traditional ways that we've delivered healthcare. So how does holistic care happen outside the walls of a hospital? Actually connecting patients and connecting other clinicians is the way forward for that. So those are the 3 themes. And in the future, what are we predicting? Well, actually, for those that are practicing clinicians, the good news is, of course, there will still be doctors and patients, and of course there will still be hospitals. And actually hospitals have a very important role in delivering that ever more specialised expert sort of care. But so much of what is currently done in hospitals and currently done in traditional settings will be done by new people in new ways and in the new environment.